Hey, I'm Manushree Navaneethakrishnan, and today I am here with Dr. Geeta Maharaj, Deputy Director of Community Health in Chattanooga. Dr. Maharaj, please tell me about yourself.
I am originally from the Caribbean, Trinidad and Tobago. My ancestors came from India, like you. Mm-hmm. And I grew up in Trinidad until high school. I came to the United States in 1987, and I actually came to the city of Chattanooga because I had an uncle here who worked with DuPont. And as you know, immigrants usually go where they have relatives or they have other immigrants who look like them.
Yeah.
So I went to nursing school here at University of Tennessee, Chattanooga. And after I graduated, I went to California, where I worked at the Long Beach Memorial Hospital, which was a big teaching hospital. And I worked in pediatric oncology and hematology for 6 years. But I really wanted to do my master's and to teach. And so after 2 years, UCLA wanted 2 years of nursing experience. I went to UCLA and did my master's as a pediatric nurse practitioner. And then I also started teaching after that. I left my job at the hospital and moved to the Virgin Islands, where I taught undergrad nursing program. And then I moved to Utah, where I taught in a graduate nursing program. And then I came back to Tennessee. My sister lives here, and I really consider Chattanooga my home in the United States. So I'm very happy to be back here, to be in this program.
You've been all over and, getting your education and then coming back for your roots. That's awesome. So as I established, she is the Deputy Director of Community Health in Chattanooga. So I do want to know, could you tell me about what you do as Deputy Director of Community Health here?
Well, I assist the director in all her responsibility
and that's
duties.
Dr. Mary Lambert?
Dr. Mary Lambert, who is pretty much my mentor in this position. And we have worked together to develop relationships. As you know, there's a big nursing shortage.
Yeah.
So we can't really do the work that we need to do without having relationship with other organizations, so we can use their nurses. We only have 2 nurse navigators.
Right, and you definitely need more than that.
And we definitely need more than that. So we are actively recruiting nurses all the time, even now. And we've been doing programs in the community. The Office of Community Health actually started off from a grant that was awarded to the city by Health and Human Services for $3.4 million.
Wow.
And so we have the capacity to hire 6 nurses and a lead nurse navigator, which we don't have yet. Okay. So we've been working on that. We've been working in the communities. We've been working with LifeSpring and with the health department and several other organizations where we use their nurses and reimburse them, and we use their immunizations and reimburse them.
Yeah, that's great. What does community health mean to you?
I think community health is really the basis of all health. I think it's prevention and health promotion, which if we do it right, we would need less acute care for a community in the hospital, which is much more expensive and a bigger hardship for patients. If we teach them how to care for themselves, how to prevent diseases, how to prevent all the chronic diseases that we have in our community, then we're doing good.
Right. Yeah. That's great. What do you think would be like the biggest problems concerning community health today?
I think in pockets where you have access to prevention and promotion, in communities where finances are not is not a problem, those communities are much healthier. So communities that are poorer and that are underserved, they have a harder time because they're less educated, they have lower paying jobs, and so as a community we need to reach out to these zip codes and teach our people, they're usually minorities to Black Americans, Brown Americans, and if we're doing our job right, we'd be teaching them how to access care, how to care for themselves, what their needs are, and where they can find these resources. And one of the main reasons I took this job was Mayor Kelly's vision to have the One Chattanooga plan, where you don't have pockets of healthy people because they're rich, but you work in the areas that are underserved, and you bring up their standard of health. And that's like my dream job, because as a nurse and as an advanced practice nurse, I think I really want to make a difference.
Exactly.
And I've spent most of my life teaching, and as you know, most of the nurses in nursing programs are white nurses. And so if you want to make a difference in underserved minority communities, that's not the place to be, I think. So this job was really something that I've dreamed about, being able to make a difference in the people who need healthcare the most.
Exactly. I'm really glad that you took that job.
Thanks.
Just like to put a little background information, Mayor Kelly's One Chattanooga plan is basically it's like unifying all the different departments of health, and I know this because of Mayor's Youth Council, but or all the departments in the community. And so that's a super condensed version. You can look more about it if you just search up Mayor Tim Kelly's One Chattanooga plan. So I would like to say, do you think that Chattanooga, like going back to your point about like low-income areas and how minorities are being the most affected, do you think Chattanooga is doing enough in terms of allotting funding for these areas right now?
Well, we've been lucky to have this grant,
Yes,
that was done through the mayor's office, and I think the setting up the Office of Community Health, which Mayor Kelly did, is a start, and as we continue this work, even after the grant, the mayor is committed to continuing the work because he sees the great need. And a lot of politicians, I think, know there's a need, but don't admit, that we have the zip codes where people are not getting services. And that's what I think is so admirable about Mayor Kelly. And I believe that he would support continuing this work and improving the work and increasing the work.
Right, and this is only just the beginning. There's still a lot more.
Absolutely.
Yes. Now, how would you say, how detrimental were the effects of COVID on Chattanooga's community health? What would you say about that?
A lot of people died in Chattanooga, like all over the country.
Right.
And, this grant that we have helped, the city to reach out to the underserved communities because Black and Brown Americans were dying disproportionately.
Exactly.
From COVID. And we know that the only thing we had was immunizations.
And a lot of people didn't have access to that, right?
Right. So going out into the community, into the health centers, into the community centers, into the city parks, and that really helped to improve the immunization.
And I would like to know, just one such instance of how we were trying to do that. I was able to actually participate in phone banking in order to provide vaccination for lower income areas. And of course, phone banking does go as it is, but that was a really great way. That was a great way to involve Chattanooga's youth in the Department of Health, and we really that's a great way to provide vaccines, because it's advocation, but also helping them in terms of immunization. So hopefully that's still going on, but that was just one little instance I wanted to let you know about.
Yeah, we did. We are still immunizing people.
Yeah, that's awesome.
We had a health fair a couple of weeks ago where we focused on heart health because heart disease is one of the highest risk factors for COVID, and we had about 80-something people attend, and about 11 or 12, 13 people got immunized still.
Oh, that's really good.
Yeah,
that's kind of
and
awesome,
we're not giving up, even though the numbers are not as great as when COVID just started, because a lot of people have been immunized. Okay. But people still die from COVID,
right? And
that's why we focus on still trying to reach out to the stragglers.
Yeah, right. Well, that's really, really good. Would you say that Chattanooga is, and you kind of talked about this before, but would you say that Chattanooga is better than the rest of the world in, the community health aspect, or worse, or just the same? Because you had said Mayor Tim Kelly was more definitely more focused in terms of community health than you have seen with a lot of other politicians, and so I just wanted to know what your thoughts were on that.
Well, we actually, the whole country has not focused on community health.
Yes, definitely.
And hopefully COVID's going to change that a little bit, because we saw the importance of public health and public health workers. And so I hope it's going to improve. We can't really compare with the rest of the country, because the rest of the world, because everybody has different healthcare systems. Right. Like Canada and the UK, they have comprehensive healthcare available, and they do a lot of work with health promotion and prevention. And hopefully we're gonna get there. Now. Yeah,
that's good optimistic thinking. So I think you've already answered this, but you said your department to improve Chattanooga's overall community health. You guys are really advocating here. You're hosting these health awareness events. Is there anything you're doing behind closed doors that not a lot of people know about for community health? Which you can disclose, of course.
Well, we've been working with partners, every day. We've met with the UT School of Medicine to try to use their residents in the community, and we still have to meet with them and take them to the community health. We've been working with the Hamilton County Health Department to actually start up a WIC clinic at the East Lake Community Center, which would be a huge service, especially that community has a lot of underserved Hispanic population that would really benefit from, instead of having to come downtown, to get WIC services for their kids and their family. They can just come after work to the community center, which is close to where they live, which is, there's a bus line that stops right in front of the community center. So we're excited
that's really
about
great.
that.
Yeah, that's really good to hear. In which areas, and this was actually really good, helping me segue into my next question, but like in which areas of Chattanooga do you think it's most evident that proper healthcare attention is lacking? You had said that one region what was the region you were referring to?
Eastlake.
Eastlake, yeah.
Yeah, well, we actually, our grant focuses on several zip codes that are underserved, that have been, that qualify for underserved as defined by the Division of Health and Human Services. And so we've been working in all of those. We have clinics.
And Eastlake is just an example of one.
Yes.
Okay. Yeah.
Just one example.
Okay. In what ways are you advocating and increasing public outreach for community health? Like in what mediums, I think. Like, are you guys very active online? Are you active?
Yes. We do have a city social media.
Okay.
And we post stuff that we're doing on there. Yeah. We do use television. We have had COVID ads on TV that have been produced by the city and using local people who's had COVID. And we also have a contract with FM 94 where we advertise our events.
Yeah. Yeah, and you said there was this public health awareness event you had done, which you were not only advocating, but you were also, immunizing people. And I think that's really, really important.
Right.
Yeah.
And so we've partnered. We have MOUs, Memorandum of Agreement, with different organizations. We partner with them. So even in activities that we don't initiate,
right,
we would still attend and assist.
That's awesome. This is my last question, what is your goal for the future of Chattanooga's community health? What would you like our community health to be like?
I would like our underserved community to be health literate, to know how to take care of their health, how to access resources, and for us to be in place in all these communities to assist with this. I think Chattanooga has the resources, and the U.S. has the resources, that we shouldn't have communities that don't have access to healthcare.
Right. Well, those are all the questions. I would like to say something like one of my key takeaways was, even with all your education, this is still a lifelong goal of yours, to have equalized healthcare. And it's also mine. And, I love to see that, there's no age, there's no sort of education requirement for us to want to have this goal. So that was really eye-opening, seeing that you have someone like me and someone very educated here, like we both have the same goal for, equalized healthcare. So, it was really great meeting you, and I really wish you the best of luck in equalizing healthcare.
Thank you. And maybe you'll graduate from college and come back and work for the city.
Yes, of course, yes.